Hello and welcome to MRI Level 1 Safety for Non-MRI Personnel, presented by Landauer Medical Physics. The audiences for this presentation are those who are not directly involved with the MRI. This involves all personnel who are helping with patient preparation and around the MRI suite. This includes personnel such as administrative staff, patient registration, housekeeping staff, maintenance staff, and radiology staff who only occasionally visit the MRI suite. This presentation is neither intended nor appropriate for personnel which are involved with patient care in the MRI suite. MRI safety is generally divided into two levels. This is intended as a Level 1 presentation. Those who are directly involved with patient care or entering the MRI suite should be using the Landauer MRI Safety Level 2 for Occupational Workers course, which is currently under development. During this course, we're going to be discussing several topics in MRI safety. The major goals of this presentation are a basic understanding of the MRI equipment and terminology, some of the risks, a definition of the missile effect and an appreciation for the possible dangers, definitions and understanding of your mobility through the 4 different zones, and some good practices to keep you and your patient safe. At the end of this talk, you should be comfortable understanding the different labels you encounter in the MRI area and how it impacts you performing your job. What is MRI? MRI, or magnetic resonance imaging, is a test which uses a combination of a strong magnetic field and radio waves to create detailed pictures of inside your body. It's a unique tool used in medical imaging. However, this unique tool has some unique safety challenges. We use magnetic fields and some complex electronics to make the water molecules in your body dance. Through a carefully choreographed dance, we can make the beautiful images such as the one seen on the right. To do this, we use a lot of expensive and carefully calibrated equipment and the magnet. Why do we have to worry about working around it? Although it may look similar to other equipment in the radiology department, it's wildly different in one important characteristic. The magnet is always on. Whereas CT and PET-CT imaging devices have a very similar external appearance, radiation safety precautions only need to be considered when the tube is emitting radiation. MRI system is always on. Even hours after everyone may have left the MRI suite, the magnet is still operating the same as when a patient was on the table. Unfortunately, many serious and expensive accidents are being reported to the Food and Drug Administration. Accidents have been shown to have an average cost in excess of $43,000. This cost includes both the repairs required to the system and the lost revenue from the downtime of the magnet. Different types of magnets are all around us. Even if you don't notice it or feel it, we interact with magnets every day. When you think of a magnet, you undoubtedly think of the picturesque images you have on your refrigerator, or that the Earth operates in the same way as a giant bar magnet. Nearly everyone had a compass when they were younger, and it always pointed to the magnetic north pole possessed by our planet. By comparison, the magnet you have in your refrigerator is more than 10 times as strong as the Earth's magnetic field. As such, it allows us to hold up those photos or grocery lists in a convenient location. Well, MRI systems are hundreds of times stronger than either of these, and vendors are constantly striving to increase the magnetic strength for better patient images. The current clinical standard magnet is a 1.5 Tesla system, but magnets of 3 Tesla and greater strength are ever increasing throughout North America, and research for ever bigger magnets is constantly progressing forward. The magnet is so strong, generally, when you feel the tug of the magnetic field, the object is likely going to be taken out of your hands and pulled towards the center and strike anything on the way. So what is attracted? Luckily, not all materials are attracted to the magnetic field. There are several different types of magnetic materials, including para, di, and ferromagnetic materials. While all of these materials present some concerns in the MR environment, the greatest concerns are ferromagnetic materials. Ferromagnetic materials are most commonly thought of as things that contain iron, nickel, cobalt. They're alloys in some natural materials like lotus stone. These can come in many different forms. They can be external hazards like a hammer or internal like a replacement joint. And while we have iron in our blood, the amount of iron is so small it's not a concern for us from a safety perspective. But items that you carry in your pocket are a major point of concern. There are numerous incidents of pens, paper clips, staplers being pulled out of pockets by mistake. Additionally, items such as mop buckets and desk chairs have been pulled into the magnet room. Finally, older devices inside a person's body have the possibility of being ferromagnetic, such as an artificial joint. While an artificial joint has never been removed from a patient by an MRI system, stents and other devices have been known to torque and cause significant damage and possible surgery to repair the damage. Of all the major accidents uncovered during a review of the FDA's reporting system, more than 90% were found to be preventable. We're now going to cover some important things to remember to leave out of the suite or talk to the MRI technologist about before entering the magnet room. In order to determine whether something should be brought or worn to the MRI suite area, it's recommended to be reviewed with the MRI staff technologists. But the following lists give you some indications on what should and shouldn't be brought into the MRI zones, which we'll discuss later. Nearly all firefighter and police equipment, general housekeeping equipment, regular hand tools, keys, watches, credit cards, ID badges, and hair clips should be removed before entering the MRI suite area. Additionally, extreme care should be used by communicating about patient equipment with the MRI technologist when bringing things into the MRI suite. Almost all patient items used throughout the hospital have magnet-safe equivalents for use in the MRI suite, including oxygen canisters, chairs, wheelchairs, stretchers, and IV poles. As well, we have to be concerned about the patient's dress and accessories. Some facilities will require patients to change into scrubs or gowns to ensure the apparel is known before entering the suite. Finally, questions are always asked during the interview process with potential MRI patients to review any possible hardware or stents the patient has implanted to ensure there aren't any compatibility issues with the study. In the event of questions, your local MRI technologist is the on-site expert and should be able to answer or get an answer regarding the appropriateness of any devices or the ability of something to come into the suite area. Just because you're not the patient doesn't mean you're out of the woods. The magnet is always on. Even if you're going into the magnet room and there hasn't been a patient on the table for 12 hours, the magnetic field is operating at the same strength and has the same risks. As a new employee in the MRI area, you might be required to undergo a screening evaluation to determine if you're able to go into that environment. Once completed, you'll be qualified to enter the magnet room. Optimally, you'll want to work in the scanner room when a technologist is present. This will allow another set of eyes to ensure there aren't any problems. Of course, this is the optimal situation and doesn't always happen. If you have to go into the suite without a technologist present, it's very strongly recommended that you alert or have others watch you and let them know of your timing. How long do you expect your job in the suite to take? Your facility may require you to have someone observe you, or you may only be allowed to work in the MRI suite while technologists are present. They're only there for your protection. In the event of a fire, the MRI system isn't immune. The first concern always is making sure that the patient is out of the room during this type of event. Most likely the sprinkler system will engage and douse any flames. However, if this doesn't work or is inadequate, we have another option known as an MRI quench. With an MRI quench, it's recommended that you talk to your facility's technologist to ensure that a policy is in place. If assistance is needed, please consult with your local medical physicist. MRI has existed as a clinical tool since the early 1980s, and in the past few decades there were numerous labels indicating MRI safety. To avoid confusion, standard labels have become popular over the past several years to clearly indicate the safety of various devices in the MRI environment. MRI Safe is the most restrictive of these labels and is a standard green text indicating it's okay to go into any MRI environment. For example, plastic screwdrivers, saline bags, and plastic wheelchairs are generally cleared as MRI safe. With all labels, Level 2 personnel, generally MRI technologists, are the only ones who should label devices as MRI safe, since they've performed extensive research on the device to ensure that it's at no possible risk, or it's been purchased to assure MRI compatibility. The next category is MRI conditional. This is likely to be the largest category in the MRI environment. It will contain objects which are safe for use in the MRI area under certain conditions. These conditions can be variable. The device may be safe for use with only one magnet in a suite with multiple systems, or safe for use only under certain conditions. Before moving it from its current location, care should be used. Either the device should be questioned with the MRI technology staff, or the label should indicate its appropriateness in various places. Finally, the MRI unsafe is the most serious and hazardous label. This indicates that the device is unsafe under any and all MRI environments. As such, extreme care should be used with these objects. They should never be brought or moved in the MRI suite by anyone other than the MRI technology staff. This might include things such as computer equipment or metal screwdrivers. We've talked extensively about the MRI suite, but the current standard methodology is to divide the MRI facility into 4 zones, with more restricted mobility and accessibility as we increase. For example, Zone 1 is a freely accessible area throughout the general hospital. Zone 1 is the hospital outside of the MRI area. It's an area where we don't worry about the MRI, and it consists of the entire hospital outside of the MRI area. Zone 2 is something of a buffer between the freely accessible Zone 1 and the more restrictive Zones 3 and 4. In Zone 2, we'll have the entrance, registration, and the patient holding areas. In Zone 2, we want to make sure that we have it set up to evaluate patients to make sure they can safely go into the MRI area. Also, this is the area where we want to make sure and leave any and all materials that can't go into the magnet room. No matter what time of day it is, remember, the magnet is always on. Zone 3 will be more restrictive and generally have some sort of barrier, such as a physical or electronic door lock. In this area, you should only find approved MRI personnel and patients. Everyone entering this area must have undergone a questionnaire and interview to enter Zone 3. Generally, the MRI control room and computer rooms are considered Zone 3. Before entering this zone, you should have undergone an MRI safety evaluation and know some basic MRI safety. Finally, the most restrictive area in the MRI suite will be Zone 4. Zone 4 is the magnet room and possibly the computer room. The dangers in this room are real, and your individual facility will have a policy in place to ensure your safety. It's your responsibility to ensure you're knowledgeable about the policy. As you can see, each of these zones is increasingly restrictive in the number of people. As such, you may have some restrictions, and it's up to you to talk to your supervisor to ensure you can remain safe while working in and around the MRI. If assistance is required in helping set up these various zones, Landauer Medical Physics can help you determine the proper layout and signage for your unique situation. The major reason we worry about various objects entering the MRI safe area is because of patient, staff, and equipment safety. We worry because of something known as the missile effect. The missile effect is something in the MRI community where we know that the magnetic field extends beyond the MRI system into the surrounding rooms. As such, if an object gets caught in the field of the magnet, it's going to accelerate towards the middle of the magnet, no matter what's in its path. Multiple deaths have been attributed to this over the past few decades. While further education and oversight have decreased the risk, the ever-increasing utilization of MRI have made it necessary to ensure that the education of everyone who works in and around the MRI systems. As we continue to increase the utilization of MRI, we have to ensure that any persons or devices around the MRI can stay safe. An old phrase which bears repeating, when in doubt, leave it out. If you're unsure about the safety of something, assume that it's unsafe. Thank you for watching this presentation, and if you have further questions, please consult with your local MRI technologists or medical physicists for further assistance.